You've had that headache 3 times this week. You took some paracetamol, drank a glass of water, and moved on. But what if I told you there are over 20 different reasons your head might be pounding and most people over 40 have never even heard of half of them? Today, we're going through the full list. Every single cause. From the obvious ones everyone talks about, to the sneaky ones your doctor might not have mentioned. By the end of this video, you're going to know your headaches better than you ever have before. So grab a coffee, or maybe not, because caffeine is actually on the list, and let's get into it. Here's the thing about headaches. They are, without question, one of the most universal health complaints on the planet. And if you're over 40 and living somewhere in Europe, whether that's Germany, France, the Netherlands, Spain, Poland, wherever you are not alone in this. Studies consistently show that tension-type headaches alone affect somewhere between 30 and 78% of the general population at any given time. That is a staggering number. And yet, most of us handle our headaches the same way we've always done. Pop a painkiller, drink some water, hope for the best. I want to say something directly to you right now. You are not imagining it. You are not being dramatic. If you feel like your headaches have changed since you hit your 40s, if they're more frequent, more intense, or just different somehow, that is real. And there are real reasons behind it. Here's how we're going to structure today. We're going through 10 categories of headache causes: tension and lifestyle, diet and hydration, sleep, vascular causes, hormonal, medication-related, neurological, environmental, structural and physical, and psychological. By the time we're done, you're going to have what I'm calling your personal headache map, an actual framework for understanding what your head is trying to tell you. Now, I do want to say this up front, and I mean it sincerely. Some of the causes on this list could indicate something that needs medical attention. I'll flag those clearly as we go. This video is educational. It is not a substitute for talking to your doctor, but being informed? That's always a good thing. Stay with me, because what comes next changes everything about how you think about that everyday headache. All right, Category 1, tension-type headaches and stress. And look, we have to start here because this is the big one. Tension-type headaches are the most common headache type globally. They affect somewhere around 75% of all headache sufferers. So if you've ever wondered why your head feels like someone wrapped a tight band around it, or why there's that dull, pressing sensation behind your eyes, you're probably already familiar with this category. Think about it. When was the last time you actually stopped and checked whether your shoulders were up around your ears? So what does a tension headache actually feel like? It's typically bilateral, meaning both sides of the head. It's described as a pressure or tightening sensation, not throbbing like a migraine. You might feel it at the back of your head, your temples, or that classic band across the forehead. There's often neck stiffness involved. It's not usually made worse by physical activity, and it doesn't typically come with nausea. Now here's where it gets interesting. Within this category, there are several distinct causes. First, chronic psychological stress. And for anyone over 40 inches Europe right now, I don't think I need to spend a lot of time justifying why this is relevant. Work pressure, financial worry, caring for aging parents while also raising your own kids, what they call the sandwich generation. That's sustained, low-grade stress that you just kind of live with. That is one of the most powerful tension headache triggers there is. Second, poor posture. And I know, you've heard this before. But desk work, long commutes, driving on the motorway for hours, or just collapsing on the sofa every evening in a position, your spine is not thrilled about all of that creates sustained muscle tension in the neck, shoulders, and upper back that refers directly to your head. Third, eye strain. This is a big one for the over 40 crowd specifically, because presbyopia, that age-related shift in near vision, typically kicks in right around 40. Suddenly reading feels like work. You're squinting at menus. You're holding your phone further away. And all that extra muscular effort around the eyes contributes to tension headaches. Fourth, jaw, clenching, and bruxism. This one is sneaky because it often happens at night, while you're sleeping, and you have absolutely no idea it's occurring. You wake up with a headache and have no clue why. Your partner might tell you they've heard you grinding your teeth. Your dentist might notice the wear pattern. The masseter muscles, your jaw muscles, are incredibly powerful, and when they're chronically clenched, that tension radiates upward into the head and temples. Here's a quick thing you can do right now. Drop your shoulders, unclench your jaw, take a breath. If any of that required actual effort, you've just done a tension check on yourself, and the results were pretty telling. You know that moment when you realize you've been clenching your jaw for the past 3 hours? Yeah, that's doing something to your head. And the insidious part about tension headaches is the cycle they create. Stress causes muscle tension. Muscle tension causes headache. Headache causes more stress, and around it goes. But that's not even the most shocking part of what chronic stress does to your pain system. We'll get to that later. Category 2. Dehydration and dietary triggers. Now let's talk about something you actually have control over today. Cause number 5, dehydration. Here's something that a lot of people don't know. The brain is surrounded by cerebrospinal fluid. When you're dehydrated, that fluid can decrease, and the brain can temporarily pull slightly away from the skull, and that causes pain. Now, this is more common than you'd think, especially after 40, because here's the kicker. Your sense of thirst actually diminishes with age. You stop feeling as thirsty, which means you drink less, which means you are probably chronically mildly dehydrated without even realizing it. If you're in a cold European climate, you're also less likely to feel hot and sweaty, which are the usual cues that remind us to drink. So the dehydration creeps in quietly. Cause number 6, caffeine. And this one is a double-edged sword. Both too much caffeine and caffeine withdrawal can trigger headaches. If you're drinking 3 or 4 espressos every weekday, which is completely normal behavior in France, Italy, Spain, and then you sleep in on Saturday and skip your morning coffee, that withdrawal headache you get by noon, that's not a coincidence. Your brain has adapted to the caffeine, and when it doesn't arrive on schedule, the blood vessels dilate and hello, headache. Cause number 7, alcohol. Specifically red wine and beer, which contain histamines and sulfites that are known headache triggers. There's also the classic delayed hangover headache, which is partly dehydration and partly the aldehyde metabolites from alcohol breakdown. And then there's the more immediate alcohol trigger for cluster headaches. Even a small amount of alcohol can provoke a cluster headache during an active cluster period. Cause number 8, skipping meals and blood sugar drops. Hypoglycemia, low blood sugar, triggers headaches quickly. If you're someone who intermittently fasts, eats late, or just gets so caught up in the day that you forget to have lunch, this is very likely contributing to your afternoon headaches. Cause number 9, dietary tyramine. Tyramine is a naturally occurring compound found in aged cheeses, cured meats, fermented foods, and soy sauce. It's a well-established migraine trigger. And look, if you're living in Europe and you enjoy a good charcuterie board, aged Gouda, prosciutto, a glass of Bordeaux, you might literally be building a headache on a wooden board. Cause number 10, MSG and food additives. Still present in many processed and restaurant foods, and a documented trigger for headaches in sensitive individuals. Cause number 11, artificial sweeteners. Particularly aspartame, which is found in diet sodas, sugar-free chewing gum, and a whole range of light products. So basically, that Diet Cola you thought was the healthy choice? It might literally be hurting your head. Not ideal. I'll reveal the exact action protocol for dietary changes in a moment, but first let's talk about what happens when you sleep. Category 3. Sleep-related headaches. The night shift problem. Sleep changes dramatically after 40. Your sleep architecture shifts, you get less deep sleep, you wake more easily, your circadian rhythm becomes more sensitive, and those changes have a direct relationship with headaches. Cause number 12, sleep deprivation. Obvious, yes. But let's talk about the actual mechanism, because it's not just tiredness. Lack of sleep increases pain sensitivity throughout the body. It lowers your pain threshold. It also reduces serotonin levels, and serotonin is closely involved in headache regulation. So when you're running on 5 or 6 hours a night, you're essentially turning up the volume on pain across the board. Cause number 13, oversleeping. This one surprises people. Sleep and headaches on weekends are extremely common. You finally get a lie-in on Sunday, you sleep until 10, and you wake up with a headache. Why? Several reasons. Serotonin levels shift with prolonged sleep. If you have a morning caffeine habit, you've delayed your first coffee, and you've been lying in the same position for 9 or 10 hours, which creates neck and shoulder tension. So the solution to your sleep deprivation is sometimes giving you a different kind of headache. Life is unfair. Cause number 14, sleep apnea. This is a big one, and I want to spend a moment on it because it is genuinely underdiagnosed in the over 40 European population, particularly in men. Sleep apnea is when your breathing repeatedly stops and starts during sleep. The oxygen drops during these episodes cause blood vessels in the brain to dilate and you wake up with a headache. The classic sign is a morning headache that disappears within about 30 minutes of getting up. If that sounds familiar, please bring it up with your GP. A sleep study can confirm it, and treatment genuinely changes lives. Cause number 15, insomnia and disrupted sleep cycles. When your sleep is fragmented, lots of waking, light sleep, trouble dropping off your body doesn't get the restorative phases it needs. The relationship between poor sleep architecture and next-day headaches is well established. Chronically poor sleepers have significantly higher rates of headache disorders. Cause number 16, hypnic headache. Now here's one that almost nobody's heard of. Imagine waking up at 2 a.m. with a headache, every single night, like clockwork, and it wakes you out of sleep specifically. That is a recognized condition called hypnic headache, sometimes called the alarm clock headache, and it occurs almost exclusively in people over 50. It's not dangerous, but it's very disruptive, and most GPs don't think to mention it. If this sounds like you, track it and talk to a neurologist. I'd encourage you to start paying attention to whether your headaches are more common in the morning or the evening. That pattern tells you a lot. Category 4. Vascular and blood pressure causes. The silent threats. Okay, I want to shift tone slightly here. This is the category where I need you to actually pay attention, because some of this has real implications for your health beyond just headaches. Cause number 17, high blood pressure or hypertension. It's often called the silent killer, and that name is accurate. Most people with hypertension feel absolutely nothing for years. However, when blood pressure is severely elevated, it can produce a specific type of headache, typically a throbbing sensation at the back of the head, often present first thing in the morning. The critical point here is this: do not use headaches as your only signal for blood pressure problems. Most hypertension headaches are not felt until blood pressure is dangerously high. Know your numbers, get it checked regularly. Cause number 18, low blood pressure or hypotension. This one presents differently. Dizziness, lightheadedness, a headache that comes on when you stand up quickly. That's called orthostatic hypotension, a sudden drop in blood pressure upon standing. It becomes more common after 40, and especially in people who are already on blood pressure medications. Cause number 19, atherosclerosis and reduced circulation. As we age, arteries become less flexible, and blood flow dynamics change. This can contribute to headaches, particularly in people who have other cardiovascular risk factors. Cause number 20, carotid artery issues. I'm mentioning this not to alarm you, but because it belongs on the full list. If you have known cardiovascular risk factors and you're experiencing new headaches, your carotid arteries are worth a conversation with your doctor. Cause number 21, anemia. Low iron means reduced oxygen delivery to the brain, and that causes headaches. This is more common in women approaching menopause, as menstrual blood loss combined with potentially lower iron intake creates a deficit. Fatigue plus headache in a woman in her mid-40s is a combination worth investigating with a blood test. Cause number 22, heart rhythm irregularities. Some people with cardiac arrhythmias experience headaches as a symptom related to changes in cardiac output and cerebral blood flow. And if your headache started recently and you haven't had your blood pressure checked in a while, that is your sign to go get it checked this week. Not next month, this week. Now here's where it gets interesting, because we're moving into the category that changes everything for people in their 40s. Category 5, hormonal causes. The 4-0 plus game changer. This category is massive for anyone over 40, and it genuinely doesn't get talked about enough. Cause number 23, perimenopause and estrogen fluctuation. For women in their 40s, this is often the most significant headache development of their adult life. Estrogen directly affects serotonin levels in the brain, and serotonin is one of the key neurotransmitters involved in migraine and headache regulation. As estrogen levels begin to drop and fluctuate, and they do so unpredictably during perimenopause, headaches and migraines can become more frequent, more severe, or change character entirely. The headache often occurs in the days before and during the period, or becomes increasingly erratic as cycles themselves become irregular. If your headaches seem to follow your cycle, that is a hormonal headache. Keep a diary that tracks both. Cause number 24, menopause itself. Post-menopause, estrogen stabilizes at a lower level, and for some women, headaches actually improve significantly. For others, they get worse, particularly if they're having difficulty sleeping, experiencing significant stress, or dealing with other menopausal symptoms. The picture is individual and complex. Cause number 25, testosterone decline in men. This one gets almost no airtime, and it should. Low testosterone has been linked to increased headache frequency and migraine susceptibility in men. If you're a man in your late 40s or 50s experiencing more frequent headaches alongside fatigue, reduced libido, and mood changes, a testosterone panel is worth discussing with your GP. Cause number 26, thyroid dysfunction. Both an underactive thyroid, hypothyroidism, and an overactive thyroid, hyperthyroidism, can cause headaches. The thyroid is dramatically underdiagnosed in the over 40 age group, particularly in women. If you have persistent headaches alongside fatigue, weight changes, temperature sensitivity, or hair loss, please ask for a thyroid function test. Cause number 27, cortisol dysregulation. Chronic stress, the kind that runs on for months and years, disrupts the body's cortisol rhythm. Cortisol affects inflammation throughout the body, including in the nervous system. When cortisol is chronically dysregulated, pain sensitivity increases. You become more headache-prone, not because there's more triggering the headache, but because your threshold for feeling it is lower. Cause number 28, HRT side effects. Here's the irony. Hormone replacement therapy, which many women take specifically to manage menopausal symptoms and improve quality of life, can itself trigger headaches, particularly in the first few months of use. This doesn't mean HRT is wrong for you. It means the formulation, dose, or delivery method might need adjusting. It's a conversation to have with your GP, not a reason to stop without advice. Your body is going through a massive transition after 40. Headaches aren't a sign you're falling apart, they're your body communicating. Let's learn the language. Category 6. Medication-related headaches. And here's the most ironic entry on our entire list. Cause number 29, medication overuse headache, or MOH, also called rebound headache. This is when the very painkillers you take for your headaches end up causing more headaches. Let that sink in for a second. The treatment becomes part of the problem. MOH affects people who take over-the-counter pain relief paracetamol, ibuprofen, aspirin, combination analgesics on more than 10 to 15 days per month. And I want to be clear, this is incredibly common in the over 40 group. Here's why. You have a headache, you take a painkiller, it works. You have another headache a couple of days later, you take another painkiller, it works. But your brain is quietly adapting to the regular chemical signal. It lowers its own pain threshold to compensate. Now the headaches come more frequently. You need more medication to manage them. And you're now in a rebound cycle that is genuinely difficult to break without medical support. Cause number 30, NSAID overuse. Same mechanism, ibuprofen and aspirin can both contribute to rebound headache when used too frequently. Cause number 31, triptan overuse. Triptans are prescription medications for migraines. They're highly effective, but if you're using them more than 10 days a month, you can develop the same rebound pattern. Cause number 32, blood pressure medications. Some antihypertensives, particularly calcium channel blockers, list headache as a side effect. The medication that's meant to protect your cardiovascular system can sometimes give you a headache as a trade-off. Cause number 33, statins. Cholesterol-lowering statins are among the most prescribed medications in Europe for the over 40 population. Some people experience headaches as a side effect, and because they've been on statins for years, they never connect the two. Cause number 34, antidepressants and SSRIs. Both the medication itself and, importantly, withdrawal from SSRIs can cause significant headaches. If you've ever reduced or stopped an antidepressant and suddenly developed bad headaches, that's why. Never stop SSRIs abruptly without GP guidance. Cause number 35, PDE5 inhibitors. That is, medications for erectile dysfunction. The vasodilation effect of these medications causes headaches in a notable percentage of users. Look, it's on the list. It's common. Moving on. Practical takeaway: review your medication list with your GP or pharmacist at least once a year. Look at everything you take regularly, including supplements, and ask specifically about headache as a side effect or interaction. Category 7. Neurological causes. Including migraine, properly explained. A lot of people think migraine is just a bad headache. It is absolutely not. Migraine is a neurological disease. Let me explain what's actually happening in the brain during a migraine. Cause number 36, migraine disorder. During a migraine, there's a phenomenon called cortical spreading depression, a wave of electrical activity that moves across the brain's cortex. This activates the trigeminal nerve, which is the main sensory nerve of the face and head. Inflammatory neuropeptides are released. Serotonin levels fluctuate. Blood vessels dilate and sensitize. The result is that characteristic unilateral throbbing pain one side of the head, often severe, often accompanied by nausea, sensitivity to light, sensitivity to sound, and sometimes visual or sensory disturbances called aura. It is a complex, whole-brain event, not just a bad headache. After 40, migraines can change significantly. For some people, they improve, particularly women post-menopause. For others, they worsen, especially during perimenopause. The pattern shifts. The triggers can shift. And importantly, if your migraine pattern changes after 40, that warrants a conversation with your doctor. Cause number 37, migraine with aura. This is relevant and important for the over 40 group specifically, because migraine with aura carries a slightly higher cardiovascular risk, particularly for ischemic stroke, especially in women who smoke or use combined hormonal contraceptives. If you have aura with your migraines, make sure your GP knows. It informs decisions about treatment and contraception. Cause number 38, vestibular migraine. This one is chronically misdiagnosed. Vestibular migraine involves headache combined with dizziness and vertigo, often significant vertigo. People end up going to ear, nose, and throat specialists thinking they have an inner ear problem. Sometimes they're told it's anxiety. It's actually a migraine variant, very common in women over 40. If you have recurrent dizziness episodes with or without headache, please look into this. Cause number 39, occipital neuralgia. This is pain that originates at the base of the skull where the occipital nerves emerge and radiates up through the scalp, sometimes all the way to behind the eyes. It's often described as a shooting, electric, or burning pain. It's caused by irritation of the occipital nerves, which can happen from neck tension, cervical spine arthritis, or old injuries. Often mistaken for migraine. Responds to different treatments, including nerve blocks. Cause number 40, trigeminal neuralgia. Less common, but one of the most intensely painful conditions known. Described as sudden, electric shock-like jolts of facial pain, often triggered by touching the face, eating, speaking, or even a breeze. It typically occurs in people over 50 and requires specific neurological management. Cause number 41, post-concussion headaches. Relevant for anyone who had a sports injury, car accident, or fall at any point in their life. Post-concussion syndrome can persist for months or years, and the headaches associated with it can resurface or worsen with age, stress, or additional head trauma. Cause number 42, brain tumors and lesions. I'm including this because it belongs on the full list and because ignoring it doesn't help anyone. It is rare. But headaches associated with brain tumors tend to be progressive. They get worse over days and weeks. They're often worse in the morning. They can be accompanied by neurological symptoms like vision changes, personality changes, weakness on one side, or coordination problems. If that description fits what you're experiencing, please see a doctor, not tomorrow, today. But for the vast majority of you watching, your headaches are not this. I want to be clear about that. The reason I mention it is so you know the difference. Category 8, environmental and lifestyle triggers. The sneaky ones that are literally just part of your daily life. Cause number 43, weather changes and barometric pressure. This is scientifically validated. When atmospheric pressure drops as it does before a storm, changes in pressure can affect sinus cavities, inner ear fluid, and possibly intracranial pressure. Many migraineurs can literally predict incoming weather based on their head. In Northern and Central Europe, where weather shifts are frequent and dramatic, this is a particularly relevant trigger. Cause number 44, strong smells and chemical sensitivity. Chemical sensitivity tends to increase with age. Perfume shops, heavy cologne, cleaning products, new car smell, paint fumes, these can trigger headaches in sensitive individuals. If you find yourself developing headaches in certain environments, chemical sensitivity is worth considering. Cause number 45, bright lights and flickering lights. Fluorescent office lighting, phone and laptop screens at night, sunlight glare while driving, strobe effects in busy environments. Photosensitivity is a common feature of migraine and can be a standalone trigger for headaches in many people. Cause number 46, loud noise and noise pollution. Chronic urban noise traffic, construction. Nightlife is a recognized environmental stressor that contributes to nervous system activation and headache. If you live in a city, your baseline noise exposure is significantly higher than it was for previous generations. Cause number 47, air pollution and poor indoor air quality. Carbon monoxide, even at low levels that don't cause acute poisoning, can cause persistent headaches. VOCs, volatile organic compounds from furniture, carpets, and fresh paint are another culprit. In winter across Europe, when windows stay closed and ventilation drops, indoor air quality can deteriorate significantly. Consider ventilating regularly, even in cold weather. Cause number 48, high altitude. Relevant for European skiers and hikers. Altitude headache is caused by reduced oxygen availability at elevation, which triggers cerebral vasodilation. Ascending gradually and staying well hydrated helps. Cause number 49, temperature extremes. Both heat, which causes vasodilation, and extreme cold ice cream headache, or cold stimulus headache can trigger head pain. These are typically short-lived but worth recognizing. Cause number 50, travel and jet lag. Circadian rhythm disruption is a genuine headache trigger. For frequent flyers or anyone adjusting to a new time zone, the disruption to sleep patterns, meal timing, and light exposure converges to produce headaches that can last several days. And here's a practical piece of advice that ties this whole category together. Keep a simple headache diary for 2 weeks. Note the time of day, the weather, what you ate and drank, where you were, your stress level, your sleep. Patterns will emerge faster than you think. Category 9. Structural and physical causes. The body mechanics section. Your head is attached to your body, which sounds obvious until you realize most people completely forget that when they're trying to figure out their headaches. Cause number 51, cervicogenic headaches. These are headaches that originate in the cervical spine, your neck. After 40, degenerative disc changes are common. Cervical arthritis develops, and years of accumulated posture habits, decades of sitting, driving, looking at screens take their toll on the structure of the neck. Cervicogenic headaches typically start at the back of the neck and radiate up one side of the head, sometimes reaching the eye. They're often associated with restricted neck movement. A physiotherapist or osteopath who specializes in cervical headaches can make a significant difference here. Cause number 52, temporomandibular joint dysfunction, or TMJ. The jaw joint is closer to your temples than most people realize. Problems here, whether from teeth grinding, a misaligned bite, or arthritis in the joint, create referred pain that shows up in the temples and side of the head. If you have a clicking jaw, pain when chewing, or if your dentist has ever mentioned tooth wear, TMJ dysfunction is worth exploring. Cause number 53, sinus headaches. Now, this is a widely self-diagnosed headache type that is also frequently misdiagnosed. A true sinus headache comes with nasal congestion, facial pressure over the cheeks and forehead, and often fever. The pain worsens when you bend forward. However, research consistently shows that many people who believe they have sinus headaches are actually experiencing migraines. If your so-called sinus headaches occur without active congestion or fever, and especially if they come with light or sound sensitivity, migraine is the more likely explanation. Cause number 54, sinusitis and nasal polyps. Chronic inflammation of the sinuses does create genuine pressure-based pain. Nasal polyps, fleshy growths inside the nasal passages, can block sinus drainage and contribute to this. An ENT specialist can assess this properly. Cause number 55, ear problems. Eustachian tube dysfunction and middle ear issues create referred pain that spreads into the head. If your headaches are associated with a feeling of fullness in the ear, muffled hearing, or pain that radiates into the jaw and temple, the ear is a reasonable place to investigate. Cause number 56, eye pressure and glaucoma. Intraocular pressure within the eye itself increases more commonly after 40. Glaucoma, if undetected and untreated, can cause significant headache and eye pain alongside gradual vision loss that's so slow you might not notice it. Please get regular eye examinations, every 2 years minimum after 40, more frequently if there's a family history of glaucoma. Cause number 57, dental problems. Infected teeth and dental abscesses refer pain through the trigeminal nerve to the temples, forehead, and jaw with remarkable efficiency. If you have a toothache alongside a headache, the tooth may well be the source. Poor bite alignment, even without acute infection, can also create chronic referred head pain. Cause number 58, neck muscle trigger points. These are hyper-irritable spots within specific muscles, particularly the trapezius and the suboccipital muscles at the base of your skull that, when pressed, reproduce your headache almost exactly. They're a key focus in physiotherapy and osteopathic treatment for chronic headaches. If a physiotherapist has ever pressed a spot on your neck and you've thought that's exactly where my headache is, that's a trigger point in action. Category 10. Psychological and mental health causes. The mind-body connection. This category gets overlooked, dismissed, and stigmatized far too often, and that needs to stop. Cause number 59, anxiety disorders. Chronic anxiety keeps the nervous system in a constant state of activation. The muscles are tighter, the stress hormones are elevated, the nervous system is primed to respond to threats that aren't there. And tension headaches are almost universal among people with untreated or undertreated anxiety. If you have anxiety and frequent headaches, they are not separate problems. Cause number 60, depression. This one genuinely surprises people. Headache is actually listed as a somatic symptom of depression. Many people over 40 with undiagnosed depression present to their GP with chronic physical symptoms, fatigue, sleep problems, and headaches rather than with a chief complaint of low mood. If your headaches are persistent and you're also finding that you've lost interest in things you used to enjoy, or you're feeling flat and joyless, please bring both things up with your doctor together. Cause number 61, burnout. The World Health Organization officially recognizes burnout as an occupational phenomenon. It's characterized by exhaustion, cynicism, and reduced professional efficacy resulting from chronic workplace stress. And it has very real physical manifestations, including headaches. For the over 40 European professional who's been carrying significant responsibility for 2 or 3 decades, burnout is not a weakness. It's a physiological consequence of sustained overload. Cause number 62, grief and emotional processing. Major life events, divorce, bereavement, job loss, children leaving home. The illness of a parent triggers sustained physiological stress responses. Grief is not just an emotional experience. It activates the HPA axis, elevates cortisol, disrupts sleep, and creates the exact conditions for chronic headache. Headaches that began during or after a major loss are not a coincidence. Cause number 63, social isolation and loneliness. Emerging research is showing that chronic loneliness increases inflammatory markers throughout the body, and inflammation contributes to pain sensitivity. In the post-COVID landscape, isolation has affected a significant number of older Europeans, and the physical health consequences of that, including headaches, are real and documented. Cause number 64, pain catastrophizing. This is a documented neurological phenomenon where anxiety about pain amplifies the pain signal itself. And I want to be very clear, this is absolutely not the same thing as saying the pain is imaginary or made up. The pain is real. What catastrophizing does is turn up the gain on how that signal is processed. If you find yourself dreading headaches before they even arrive, constantly monitoring for them, or feeling significant fear around them, that relationship with pain is worth addressing with a psychologist or pain specialist. Mental health is physical health. Treating your mind is treating your headache. There is no separation, and there is no shame. Now, before we get to the solution section and your action plan, I need to talk about something important. These are the headaches that should send you to the emergency room, or at the very minimum, have you calling a medical professional immediately. I'm not trying to scare you, but I would be doing you a genuine disservice if I left this out. The first and most critical is the thunderclap headache. This is a sudden, severe headache that reaches maximum intensity within seconds to a minute. People describe it as the worst headache of their life. If this happens to you, stop what you're doing and call emergency services. Do not drive yourself. A thunderclap headache can indicate a subarachnoid hemorrhage bleeding in the brain and is a medical emergency every single time. A headache combined with fever, a stiff neck, and sensitivity to light is a red flag for meningitis. Again, emergency services. A headache that follows head trauma, even a minor one, warrants evaluation. A headache accompanied by vision changes, confusion, sudden weakness on one side of the body, or difficulty speaking could indicate a stroke. Use the FAST acronym if you're uncertain. Face drooping, arm weakness, speech difficulty, time to call emergency services. A new headache pattern in someone over 50, particularly one involving tenderness at the temple area, jaw pain with chewing, and scalp sensitivity, may indicate giant cell arteritis, also called temporal arteritis. This is a condition that predominantly affects people over 50 and is genuinely more common in Northern European populations. It requires urgent treatment because without it, there is a significant risk of vision loss. A headache that progressively worsens over days and weeks. A headache that consistently wakes you from sleep, not hypnic headache, which is its own recognized thing, but new, progressive nighttime headaches. Any headache accompanied by neurological symptoms you can't explain. The vast majority of headaches are not emergencies. The fact that you're watching this video and learning about your headaches means you're being smart about your health. But your health is absolutely worth a phone call when something feels different to what you normally experience. trust that instinct. And now the part that ties everything together. Your action plan, your personal headache map put into practice. Step 1. Start a headache diary. This is the single most useful thing you can do. For every headache, record the time it started and stopped, the location on your head, the type of pain throbbing, pressing, stabbing, the intensity on a scale of 1 to 10, what you ate and drank in the previous few hours, your sleep the night before, the weather, your stress level, your menstrual cycle if relevant, and any medications you took. 2 weeks of this data is genuinely powerful. You will start to see patterns that your brain was not tracking on its own. Step 2. Review your medications with your GP or pharmacist. Bring every single thing you take: prescription, over-the-counter, supplements. Ask specifically whether any of them list headache as a side effect, and whether your frequency of pain relief use puts you at risk for medication overuse headache. This is an annual conversation worth having. Step 3. Get your blood pressure checked if you haven't done so in the last year. Most pharmacies in Europe will do this for free. It takes 2 minutes. Know your numbers. Step 4. Get your eyes tested, especially if you're over 45 and you haven't been in the last 2 years. Presbyopia, uncorrected refractive errors, and early glaucoma are all within the window of normal age-related changes, and all are detectable with a standard eye examination. Step 5. Talk to your GP about any new or changed headache pattern. Not a headache you've had for 20 years, that's exactly the same. But any headache that has changed in character, frequency, severity, or timing in the past 6 to 12 months. New patterns warrant investigation. Step 6. Consider a physiotherapy assessment, particularly if you have neck stiffness, if you do desk-based work, if you drive long distances regularly, or if your headaches are consistently at the back of your head or one-sided. A good physiotherapist can identify cervicogenic contributions and trigger points that are completely treatable. And step 7. If you think hormones might be playing a role, ask your GP for the right blood tests. For women over 40, that might include FSH and estradiol levels. For men, testosterone. For anyone with the right symptom cluster, thyroid function. These are simple blood tests that can provide enormous clarity. So let's step back and look at what we've covered today. 10 categories: tension and stress, diet and hydration, sleep, vascular and blood pressure, hormonal, medications, neurological, environmental, structural and physical, psychological, and over 60 individual causes within those categories. Here's what I want you to take away from all of this. Headaches after 40 are common, extremely common. But common does not mean normal, and it absolutely does not mean you have to just accept them and push through. Every headache has a cause. Every cause has an explanation. And most of them have solutions, or at least strategies, that significantly reduce the burden. You know your body better than anyone in the room, better than any doctor who sees you for 10 minutes once a year. Today, we gave you a better vocabulary for what your body is trying to communicate, and that vocabulary is genuinely powerful. Now here's my ask. If this video helped you, if you learned something, if something clicked, if you recognized yourself in one of these categories, please hit the like button. It genuinely, practically helps more people in their 40s and 50s across Europe find this content when they're Googling their symptoms at 11 p.m. wondering what's wrong with them. Subscribe so you don't miss what's coming next. We've got videos on managing migraine without medication, what your sleep pattern reveals about your health after 50, and the full breakdown on hormones in the body after 40 that I think is going to genuinely surprise you. And most importantly, drop a comment. Tell me, which cause on this list surprised you the most? Which one made you go, oh, that might be it? I read every single comment, and your response genuinely shapes what I make next. Take care of your head, take care of yourself, and I'll see you in the next one. Quick but important note, everything in this video is for educational and informational purposes only. It is not medical advice and is not intended to replace consultation with a qualified healthcare professional. If you are experiencing concerning symptoms, including any of the red flag symptoms mentioned in this video, please seek medical attention promptly. Always consult your GP or specialist before making changes to your medications, supplements, or treatment plan.